Welcome to the fourth soundbite edition of the Physio Matters Podcast, brought to you by IFOMPT 2016. Our latest podcast with Dr. Jeremy Lewis marked the opening of registration and abstract submission, and this one with Professor Joel Bialosky is launched with exactly a year to go until the MSK event of the decade, IFOMPT 2016. So let's get to it. Greetings from a not-so-sunny Manchester to a rather sunny Florida. How are you today, Joel?
I'm doing well, thank you.
Good stuff. And so just to, for those who might not be aware of your work, would you like to introduce yourself for the listeners?
My name is Joel Bialosky. I'm a clinical assistant professor in the Department of Physical Therapy at the University of Florida, which is in Gainesville, Florida. And my research interests have to this point been in the mechanisms of manual therapy. So not whether or not manual therapy interventions are effective, but why they're effective and why they may be effective for some of our patients. And what I'm really interested in are changes in pain processing that accompany manual therapy interventions. And I'm also interested in placebo, or the context of how we provide our manual therapy interventions. We know that if we give somebody a placebo, a supposedly inert agent, but we do it in a particular manner, we do it in a way that enhances expectation for it, or we're very nice to the person while we're providing it, we can see a very robust analgesic response. And so what I'm interested in is then how or the role of placebo as a mechanism in our manual therapy interventions, and also is there an additive effect? If we do things we know can enhance the effectiveness of placebo and take that and apply that to manual therapy interventions, or what we think are active interventions, is there an enhancement of the treatment effect that we see in response to those manual therapy interventions?
Fantastic. And as you say, I think people will be fairly well ensconced with your work in that area. But what led to the interest and then specialism in that?
I worked for 14 years as a clinician before I came to the University of Florida to get my PhD. And most of my time in the clinic was working in an orthopedic outpatient setting with people with musculoskeletal pain. I developed a real interest in using manual therapy interventions on my patients and saw firsthand how effective they could be for some of the patients. But what I always was curious about was why that was. Why was it that when I used a manual therapy intervention and it worked, why did it work so well and oftentimes so quickly? And the other thing that always made me very curious is why other schools of manual therapy also worked. I was trained in certain manual therapy approaches. In the clinic, you work with people that use other types of manual therapy approaches, and it was always very interesting to me to see how similar outcomes could be with such diverse types of approaches. And so that led me to this interest in why at times were clinically effective.
Okay, brilliant. And that journey of both clinically and then research-based has led you to now. And as someone with an interest in your work, I often put it into the noses of colleagues. And one of the most common responses is, okay, manual therapy works. Why does it matter how it works? Clearly from your research, I can only guess that you do feel it does matter, but why is that? What would you say to those people?
Yeah, and that's a very common question, and my answer to that, the way I think about that is,
to hear the remaining 12 minutes of this podcast, head to ifomptconference.org, where you will also find our previous 3 full-length interviews with Roger Kerry, Annina Schmid and Jeremy Lewis, all of whom are keynote speakers at IFOMPT 2016 in Glasgow. So I hope the cliffhanger was tempting enough, and I'll see you over there.